But before we start, we want to hear a quick word from our sponsors.
My name's Dustin Rock, and I'm here to talk to you about revenue sharing strategies. This is an issue that's affecting thousands of dental offices every year. Don't let yourself and your patients fall prey to these models that can cost you more and more money. If you already have, it's not too late for you. You can get help from our office because we care about you. Call BoomCloud and let us help you get out of this trap.
What's up, everybody? My name is Jordan Comstock. I'm the founder and CEO of BoomCloud. I got with me today Dustin Rock, the VP of Sales for BoomCloud.
What's up, everyone?
And we're going to be talking today about the dangers of revenue share when it comes to membership programs and using software tools to manage your membership program. We're seeing a lot in the industry where there's other companies out there that will create what they call a revenue share program, right, Dustin? And they're going to take a percentage of your revenue. What are some of the examples you've seen out there, Dustin?
To me, it's just usually talking to offices. It's when you see the potential of this when they have especially when they have a large number of people, it makes sense really quickly.
Yeah.
When I talk to offices that do a demo with us who already have, I did one the other day with about 500 members, and you start showing them what the cost would be to implement that into a software that's going to take a percentage of that revenue, and how quickly that cost just rises up versus doing a model like what we have where that price is always going to stay the same.
Yeah, so an example of that is there's a company out there that charges between 10% and some often charge up to 25%. I've seen a few of those. They're not as common as we see in the industry, but 10% to 25%, if you're charging $35 per month per patient, right, that company is going to take between $3,500 to almost $9,000 a month if you have 1,000 active patients, which can be done. Getting 1,000 patients can totally be done, especially if you've got marketing channels. If you've watched my video about creating and growing a membership program with tips on marketing. Another company takes between $3 and $6 per month per member, which that adds up once you get to around 1,000 members. That's going to be around $3,000 to $6,000 a month. Just when you hit 1,000, if you keep growing from there, it's going to keep increasing. So my question is, do you want to increase your expenses, or do you want to increase your profit when you create an in-house membership program?
Profit seems like the good choice to me. But,
I would say
I'm a simple guy with simple needs. So, well, and that's where that's kind of showing that high potential number. I'll even break it down with offices too. What happens when you're at 100 members and you're paying $400 a month? 300 members, $1,200 a month or more. It's not even just this when you get this really large. This is something that we have offices obtain that number in a very short period that they might have 200 or 300, and now that's $1,000 mistake that they didn't realize they were going to make. And the problem with all that is, next thing you know, they feel stuck in that because the effort it's going to take to move that over to a new option for them. A lot of times, even if they want to save that money, they don't want to go through that work, and now they're stuck in a model where they're just giving money to someone else that's not doing any more work for it.
And in my opinion, Dustin, I think it's worse than insurance, right? Working with a PPO, because the PPOs make you discount, but a program that takes a revenue share of your practice actually takes the revenue, right, from the practice. And I think that's almost worse if you ask me. But we were talking earlier this morning about an analogy about the CEREC machine. If we were to buy a CEREC machine and use the same rev share model, if CEREC said, okay, every patient you use the CEREC on, let's say you have your base pay with the CEREC machine when you buy it, right? It's a base, let's say it's $1,000. Don't quote me on that, I'm not a CEREC salesman. $1,000 a month, and let's say every 100 patients you use for that on your CEREC machine, that fee increases another 1,000. So when you get another 100, it increased to 2,000. When you get another 100, it increased to $3,000 a month. Would you buy the CEREC machine if it worked like that? Dustin?
I know I wouldn't. And hopefully that model isn't what you guys do, because if so, then yeah, we use that as an example, but I hope it's not. And that's to me what's kind of crazy about it, because right now we assume you go to a dentist that they're going to try to get as many people to use it because they're making more profit. But we use that as an example. If that's what you're essentially doing with the revenue share
with
model, with the membership program, is that machine, you shouldn't really be paying more for it to do its job. It's already in your office.
Yeah.
It doesn't take a software company that much more work to handle more members, but yet you're paying out in these other models where you're sharing that revenue more and more money for very little return and effort that they're doing to help you manage that larger group of members. So one of the things I'd say is just keep in mind the potential of growing your membership program. I think when people get scared into this model of revenue share, it's because it sounds really good at first, or they don't see how many members they can actually have in their membership program. And so it's, I'm not spending much money right now, but you're not seeing the big picture of how many members you're gonna have and how fast this can cost you. This is a no-brainer on the opposite end to an office that has 500 members. You show them this model, and I've had that happen where I say, well, here's some of these other pricing models. It's gonna cost you, $2,000 starting right now. Who's gonna do that? Nobody is. But the problem with that is most of the time you put all that data in and you don't want to have to go through transferring it. So someone starts out small, grows this quick, next thing they know they're paying that fee and they don't want to go through that change that it take to go to a model that's costing them less, and now they're just stuck in it. So understand that you can grow this big at a very short period as long as you have confidence in it and you do the steps needed to grow it.
And if you do have an existing membership program and you're using another platform, you feel stuck and overcharged for it, give us a call. We do have a team that helps input all the data into our system as well.
So one of the other things that I kind of find interesting is that I get a lot of calls from marketing companies or consultants for dental offices that all see the potential in this. They want their offices doing it, they see the value in it, and they see the potential from the marketing side of how this can bring new patients in. As well for the consulting side, not just that, but the value it brings to the office. So it's weird because a lot of times the dentists are the ones that aren't really just getting the picture of this. So if you're not sure about why you should do this, talk to your marketing company, talk to those that will help you grow this, talk to your consultants, because they're the ones that are going to back why this is such a smart decision to implement in your office.
So, conclusion, don't sign up for a membership program software if it's going to take a cut of your revenue. Now, there are pieces of it where you're going to have to give away your merchant fee, right? That's pretty standard with credit card companies. For example, we work with a merchant company, but we do not see that revenue. That merchant fee revenue does not come to us at BoomCloud. That is just a standard of when you're working with credit cards. You can also use ACH and that will lower it. But I would, if you're looking at membership program softwares for your practice to help you grow and manage your membership program, keep that in mind. Do not sign up with a program that will take a percentage or a per member fee, because it'll add up as you grow. Because think about it, over half the United States does not have dental insurance. That means there's more people without dental insurance that will fit for your in-house membership program than people that have dental insurance. So keep that in mind, that the market for this is huge, so the potential of it is huge for your practice. Meaning if you sign up for one of those software companies that take a percentage or take a per member fee, then you're going to really regret it in the long run. So I encourage you guys to schedule a demo for BoomCloud. If you haven't, you can do so on our website. Just at the top corner there, you'll see schedule a demo. Do that, you'll talk to this guy or others from our team, and they'll help you get educated on how our software works and how our pricing model works. So with that said, we hope you guys have a rockin' day.
Yeah.